Welcome, everybody. This is our Quality Reviews live video webcast. My name is Edward Shin, and I am the CEO, co-founder of Quality Reviews, and we help health systems improve experience through real-time feedback. And we've been working with Chao at HSS for a number of years now, and it is my pleasure to formally introduce Chao Wu, who is the Chief Patient Experience Officer and Assistant Vice President at Hospitals for Special Surgery. And I'm just going to basically turn it over to Chao right away. But before we get started, Chao, maybe you can just tell the audience a little bit about yourself, your background, and how you got into experience and patient experience in particular.
Yeah, so I'm Chao Wu. I've been in healthcare for over 20 years. And I have to tell you, healthcare is a very exciting space at this moment in time. I would like to say I went ahead and pursued my education to become a healthcare administrator, but I didn't. I think my desire to work in the hospital setting started when I was in middle school. We had a Take Your Daughters to Work Day at our middle school, and I grew up in Washington Heights. Uptown Manhattan. So I went to New York Presbyterian Hospital, and we had a wonderful day with all the physicians as well as scientists and different disciplines, kind of telling us what they do in healthcare. And I fell in love with it, and I thought I wanted to be a clinician. But fast forward to college, and I couldn't deal with thinking about working with patients on the clinical side. So I decided, hey, I'm an analytical person. Let me pursue some finance and see how that takes me. And then over time, I realized my desire for projects, integrated with my love of the sciences, and slowly but surely, I made my way to healthcare as a
That's
project.
awesome.
Yeah. I mean, listen, anybody that's in healthcare starts off with, I want to contribute, right? But I think in their growth and development, you kind of realize everybody contributes in a different way. And for me, I think my contributions to the healthcare team is really not with providing direct care, because I struggle with the sight of blood. So I really admire all that, our clinicians, even you, Dr. Shin, what you do, but I can't do that. And so what I can offer is really help with projects, help communications, and more importantly, bring the data to affect change. And then more importantly, be part of the team. So that's where I
Nice.
am and where I came from. But more importantly, my history of HSS started about 14 years ago. Before that, I was at the New York City Department of Health and Hygiene, working towards promoting better practices to manage patients with chronic diseases like diabetes. But when I came to HSS, I just couldn't leave. And I just felt the culture, the people, and also the organization and the values really meshed with my desires and what I wanted to do. So I'm really privileged to be able to share our experience, especially in working with you and your team, with elevating our patient experience, as well as creating a service recovery opportunity, because, healthcare is an imperfect system. We always have to understand that we're dealing with people, not production, right?
Yep.
So feelings, it's really, understanding what's unmet, and then also dealing with that connections we have with patients. So I'm very privileged to share this information with colleagues across the United States, as this is a very interesting time in our history.
Yeah, no, absolutely.
you know,
To say the
uh,
least.
to say the least, right? And hopefully it's the worst that we ever encounter in our lifetimes, for sure.
Yes.
But my goal here is to share what we did to elevate our patient experience, also how we pivoted during the pandemic, and then more importantly, talk about the challenges, because all of us are encountering that.
Yeah. Okay, great. Well, I'm going to turn it over to you, and you can go through these slides really quick. I do want to keep this as interactive as possible. So for everybody who's in the audience, feel free to type in questions as they come to you. You can put them in the chat box or in the Q&A box, and we'll queue them up, and we'll deliver them to Chao towards the end of the presentation. So I'll turn it back over to you, Chao. Thank you.
Wonderful. Okay, so I want to start by giving some background about Hospital for Special Surgery, because we have a very unique name, right? Special surgery, what does that represent? So we can only achieve that by giving you some history about HSS. So HSS is the oldest orthopedic hospital in the United States, and we were started and founded by Dr. James Knight in 1863. And if you look at the first picture on this slide, this is where it started, and it started in his house, in his residence. And the goal for Dr. Knight was really to provide orthopedic care and services, and provide rehab services to patients with disabilities. And that is just at the heart of, providing care and the heart of a clinician. And so this location was actually on 2nd Avenue and 6th Street. And the interesting thing is, Hospital for Special Surgery is what we're known for, but what we were registered and the name we're known by back in the days was actually the Society for the Ruptured and Crippled. Interesting, right? And then over the years in our